Hi, everyone. Welcome to this meeting of G100, Oneness and Wisdom. We have with us Anna Costa and Dr. Babita Singh, Dr. Sucharitra Picasso, and Dr. Kalyani Patil. And also our the country chair, our Anu Nadimpalli madam. She was supposed to be here, but she is busy with her travel. And Dr.Prachi Beriwala is also busy in some meetings. So maybe they will join a little bit late. So let's continue our topic. The topic is Female Hormonal Orchestra, Balancing the Symphony of Change. So this is all about the female body, the female hormones, how they play the orchestra, and what happens if there is a disruption in the symphony of this orchestra. So let's start with what is this female hormonal orchestra? What do you mean by this? Is it a music orchestra? Yeah, something like that, you know? So, and why it is important? We all know that females are a little bit moody. So why this mood changes happens if there is a disruption of the hormonal orchestra, right? So this female hormonal orchestra refers to a very complex cyclical interplay of the hormones. And here, primarily the main hormones which are responsible are the estrogen, progesterone, and testosterone, even though in minute quantities. So it is orchestrated by the brain. In the brain, there is the pituitary gland, the hypothalamus, which regulates the reproduction in the female and the mood changes, the metabolism, and also the bone health. So in the different stages of life, as required, it is balanced and regulated. Also, along with that, there is the oxytocin. Oxytocin, it is called as the love hormone, also the cuddling hormone. It helps in the bonding between the mother and the child. And there is a thyroid hormone, which also plays a pivotal role. So here, this hormonal orchestra with all these hormones, there's a syncing and then a playing a beautiful, regulation of the hormones, and then the female, the Shakti in the female works in its fine tune. So this is what is important. That is why I took this topic. So here, the oxytocin and thyroid hormones, it works independently and it manages the specific functions and it synchronizes the reproductive behavior and the metabolism in the female body and also the stress responses. We all know that the oxytocin is called as the love hormone. It facilitates in the birth, in the bonding, not only between the child and the mother, but also in the family, all the people. The love, which is the main, ingredient of a female thing. So that is found, that's why she's called as the mother earth. So it resembles somehow in the female body also. So let me tell you about how this oxytocin is produced in the hypothalamus. It is released by the posterior pituitary in the brain, and it also manages the childbirth. So the contractions which happen in the uterus, the oxytocin is responsible for that contractions. Somehow when there is a delayed labor, you may all know. So what happens? The oxytocin injection is given, isn't it? So that the labor pains, they just go on and the childbirth is not delayed. And also the social bonding, the mental health, for all this, the oxytocin is responsible. And then the thyroid hormones, that is the T3, T4, they help also in the reproduction, the developmental factors, and the metabolism. And here, along with this estrogen and promotion of the estrogen and also regulating the oxytocin, the TH helps, the thyroid hormone helps here. So here it influences the oxytocin and it gives expression in the brain. At the paraventricular nucleus inside the brain, near the amygdala, there is it gives a gene impression to the brain, and from there the maternal behavior starts. So see how there is a cycle of the movements or the cycle of changes or cycle of expressions happening inside the female body. And that's how all the hormones, they are regulated and then they are monitored by the brain. So the brain is the main coordinator or the monitor of all the hormones. Okay, but that's how the cycles happens. Now, if any disruption happens in this cycle, then all the problems start, right from the stress, the mood changes, and then the bone health, then the female menstrual cycle problems, the perimenopausal problems, then the menopausal problems, which all are supposed to be natural if there is a hormonal balance. But if there is a disruption in this female hormonal cycle, then all the problems start. So let us discuss further. And let me continue this with Dr. Kalyani. She will explain about the science and out of tune orchestra. So if this hormonal cycle goes out of tune, what happens? Yes, Dr. Kalyani. Yes, unmute yourself.
Yes, thank you, Dr. Rajeshwari, ma'am. See, many women think that their hormones suddenly get disturbed, but hormones rarely become chaotic overnight. They whisper before they scream. Okay, so I've noticed many patients come to us and they just say that, Madam, fix my hormones. But no one asks that why in first place the hormones are disturbed. See, irregular periods, then PCOS, thyroid, mood swings, acne, hair fall, hair thinning, all these are the symptoms that your body is giving you some signs that please look after it, because your body always tells you to be honest with yourself. Okay, see, what are the early signs that your skin becomes dry, your hair becomes dry, frizzy, they start thinning, you particularly get hair fall from this part of the hair, then your energy level becomes very low. And all these signs are so subtle that many women think that, okay, this is happening with many of the my relatives or my friends. So this is very normal. And they take it granted. And then the problems start getting worse. So you should not miss all these early signs of the disease.
Hmm. Yes.
Yeah.
Is what do you have to say, Anna, about this, about the disruption in the female hormones?
Well, from my experience and like working with women and
I
seeing
think
the
your
women.
voice is not so audible.
Oh, yeah. Can you hear me? Can you hear me now? Is it better?
Yeah, better.
Okay. From my experience working with women on their sexual health and women in my life and my own experience, I see that as soon as we interfere with anything, whether that is with our menstrual cycle, giving birth, or even later at menopause, the more we interfere, the more issues we actually create. And when I say, what I mean by this is using the birth control pill. I'm not sure, how spread out that is where you come from and where you are based in the world. But me being based in Europe, I see this is a big problem, and simply just doctors very lightly prescribing birth control pill to teenage girls, which are not even tested or tried on teenage girls with very little research, with very little information to solve problems like acne or to prevent pregnancy, whereas we then trigger a million other issues. And then when women are for a long time exposed to these kind of, let's say, side effects of something that disrupts the natural orchestra that actually is probably supposed to work the best, then we have a lot of issues. With the childbirth, it's the same. You said women are given oxytocin to stimulate the labor when nothing happens, but actually the synthetic oxytocin called pitocin is not the same like natural oxytocin. It does not it does kind of help do the work mechanically and technically, stimulating the contractions, but it does not help a woman experience less pain, because the real oxytocin would actually help reduce the pain, and the birth would be much less painful in that case, and much easier on a woman's body, rather than with the synthetic hormones and so on. So this is something that I have noticed in our modern world, that the more we interfere with anything, the more we kind of spoil the orchestra, and we rush to interfere too soon, as the Dr. Kalyani said, like, fix my hormones. It's like people just want to take a magic pill and fix everything, but that doesn't work like that. Instead of just trying to fix something with a pill, let's try to understand why it happened, and what could be some natural causes, remedies, whatever. And then I've seen women, after they have tried the pills and everything, then they go back to more natural solutions, homeopathy, Chinese medicine, and these kind of things to actually, and then they solve their problems. But it's a long journey.
I would like to ask you, because you're a relationship coach, isn't it? And
yeah, I'm a sexuality and relationship coach.
And what is it? Sex and love relationship coach. So how would you relate this changes in the female hormones, disruptions in the hormones, and the mood effects, and conflicts in the family, and all these things?
All these things. It does affect women. For example, more and more research is coming out that when women take a birth control pill, that actually kind of prevents them from choosing the right type of partner they would actually choose if they were not on the pill. So it's kind of messing up with the whole system, and it makes us attracted to people that we wouldn't be attracted to if we were not using the pill. Just to start with something more important. And then of course, then women get off the pill, want to have kids and all of that, and then the whole issue starts with.
Sucharitra, I would like to continue with this discussion.
Mm-hmm.
Out of tune, female
out of tune. Yeah, as Anna mentioned, I also agree that taking synthetic hormonal pills, that also interferes with your normal cycles, and thus it can lead to many other because you are just playing with the natural hormones which are released by the body, and you are unnaturally playing with them. So it can cause many other consequences on the body, like delaying menses, or excessive production of testosterone, or maybe some other hormone.
Hello, Dr. Prachi Beriwala has come.
Okay.
Welcome, ma'am. Nice to see you. Please keep your camera open. Unmute.
Yeah, I'm so sorry. Hello, everyone. Good evening. Namaskara
Good evening.
from
Good evening.
India. I'm Dr. Prachi Beriwala, and I'm the country advisor for G100 Wellness and Wisdom. So thank you, Dr. Rajeshwari, for picking up this topic, and thank you everyone for joining here. So those who do not know, every month at G100 Wellness and Wisdom, if I would say every fourth Saturday at 7:30 p.m. sharp, you will see us going live. and we will come up with something different, which actually generates a lot of oneness amongst us. Now you can see people are there from various parts of the globe and gaining wisdom. So I think that's the motto of G100 Oneness and Wisdom. And Rajeshwari ji, you please excuse me because I think we have more expertise today talking about the,
Yes.
like topic. So yeah, so I will be the good audience today.
Okay, ma'am. Fine. Thank you for being here along with us.
Yeah.
And we are waiting for Anu ma'am to join also. She's the content.
Anu might or might not join
Oh,
Rajeshwari ji
okay.
because she's traveling actually.
Okay. Okay,
Yes.
so continuing with Dr. Sucharitra about the out of tune orchestra, female hormonal orchestra.
Thank you, ma'am. Thank you, Dr. Rajeshwari and G100. Yeah, I would like to mention the normal menstrual cycle first, because if we don't know the normal menstrual cycle, then we won't be able to differentiate between the normal and what is abnormal. Because many patients come to us and they ask, I get, menses for these duration, or I get the cycle after these many days. So is it normal or not? Shall I consult a gynecologist? So I think we should know about the normal cycle. Like usually normal cycle lasts between 21 days to 35 days. And if it is 28 days. And duration of the bleeding, like which we call menses, it lasts between like 5 to 7 days, right? 3 days are also taken as normal. And there can be, slight variation in the cycle. Like it can vary month to month and duration as well, right? And flow usually happens like first few days are supposed to be heavy menses, followed by less and less, flow. And like if you just see the common symptoms which a female, experiences before the menses, many of us, experiences lower backache or, pain in the lower pelvis and mood swings or maybe irritability, tenderness of the breast and bloating or fatigue, which is taken as the normal signs and symptoms experienced before the menses, right?
Yes.
If yeah, if we see the four phases of normal menstrual cycle, it is divided into four phases. Like first is menses phase, which lasts between 1 to 5th day, and there is shedding of the uterine lining, right? Then comes follicular state, like which is between 1st to 13th day, and when the hormone FSH, like follicular stimulating hormone, that is released from the pain, and estrogen levels also increases to thicken the uterine lining, and it helps in maturation of the egg from the ovary, and are both the ovaries, they play alternately, right? Sometimes it also happens that both the ovaries releases the eggs at the same time. Then the bleeding will be more, right? But mostly in majority of the cases, like if the right ovary is ovulating, then another left ovary will ovulate maybe on the next month, right? And ovulation takes place on the 14th day, ideally, if the female is having a menstrual cycle of 28 days. 14 days is supposed to be the ovulation day. Like when the female might experience some mood swings or maybe spotting during that time. And luteal phase happens between 15th day till 28th day, and body prepares for the potential pregnancy if it occurs, and hormone levels drops leading to the next period. So this is the normal menstrual cycle.
And one more thing
So
I would
that,
like to add is
yeah,
the
yeah, sure,
progesterone.
sure.
The progesterone, which is also called
Yeah.
as the pregnancy hormone. So what
pregnancy
happens if
hormone,
there are
right?
pregnancy, there is no pregnancy, and then what
Hmm.
happens to the corpus luteum and how the menstrual cycle, how the womb cries, that is the bleeding occurs. And suppose if there is a, you know, a meeting of the ovum and the sperm, and then the pregnancy occurs, to mature the sperm and the ovum, and to maintain that conception stage, that's where the progesterone helps. Now, could you continue with this, Dr. Babita Singh? So, what
Yeah,
happens if the couple is not, the lady is not able to conceive? What things are
that
happen, and
yeah.
the
Thank
role
you,
of
Dr.
progesterone?
Rajeshwari, ma'am.
Yeah.
Yeah, when that progesterone, which is there, which is most important, or hormone for the implantation and the preparing of pregnancy. Most of the couple, when they come, they tell us that we have this and this levels of estrogen, progesterone, all they have been like checked, and anti-miliary bodies, everything they come and with us with all the reports. So it is we who see about like progesterone is on the lower side, definitely. This progesterone is the thing which is preparing for you for the
You're,
endometrial lining. Hello, yeah. The
yes, yes.
endometrium lining thickening is done with progesterone hormone. It is basically immediately after ovulation takes place, when there is no this thing conception or sperm implantation is not there, that then progesterone decreases. When it is there at the highest level, then definitely it helps in implantation of the fetus, preparing the placental lining, preparing hormones. Definitely estrogen, everybody knows like estrogen is there. It is a causes all the menstrual cycle control and the sexual characters in the women. And one point is estrogen is also a beauty hormone, ma'am,
Yes, it keeps
because it
skin
is
glowing.
uh,
It keeps your skin glowing. It keeps your mood happy. It
like the collagen formation is done with this estrogen hormone. Whatever your elasticity is there, maintaining the skin, all those things, hyaluronic acid, everything is all related to estrogen, which in nowadays the cream and all are coming for that. No estrogen, then progesterone, which is immediately related after estrogen work
yes,
is over, progesterone starts its work for pregnancy.
this
If it
is
is
very
not there,
important for all the females to know that if your hormones are disrupted, if they are
yes,
not working well, how many
hmm,
beauty creams you apply, it won't work.
it is
So,
useless.
yes.
And
So,
definitely, I'll mention one point about this. Along with estrogen and progesterone, testosterone is the hormone which keeps up the libido.
yes,
That is not a male primary hormone. I know that is a male primary hormone, but definitely it is the hormone which is released from the ovaries, which helps in maintaining the libido, your cardiovascular system, your bone density. Everything is done with testosterone. And progesterone, definitely progesterone, everybody, I don't know, must be knowing, progesterone is inversely proportional to cortisol. You know,
yes,
when we are in stress, cortisol is released. When the cortisol, more cortisol is released, the progesterone goes on decreasing, decreasing, decreasing.
correct.
So that's why many women who are in lot of stress, they come like we are not able to conceive, not able to conceive. So that is the reason they should know that it is all because of your hormones. Progesterone is going down and down and down. Why? Because your cortisol is going up and up and up. And
Yes.
why cortisol is going up? That is all because you have stress. That
This is
your
a very
master gland
important point you have
hypothalamus.
mentioned. And let me tell you, sorry to interrupt you, but let me tell
Yeah.
you, all the audience, female audience who are listening to us, your work stress, your personal life stress, your family stress, whatever it is, you have to keep it in check.
Yes.
We are going to come to the lifestyle management also in the
Yes.
last.
Yes.
So this it plays a very important role, as Dr.
Uh,
Babita said. So
your magnesium or your vitamin C intake, your sleep, lifestyle, and your like main is exercise and all that will help you in deep breathing. Everything it has to be maintained. So that's how your symphony, your orchestra of your this thing goes on. The hypothalamus is your master gland that is conducting all this orchestra symphony at one. Like it is main, like musician is playing different music, and that control, that conduction is done by your hypothalamus. That your hypothalamus, anterior, posterior, pituitary. In posterior, you told oxytocin. Anterior pituitary, it releases many hormones: growth hormone, gonadotropin hormone, all
luteinizing
most important.
hormone, follicle stimulating hormone, prolactin,
Everything,
all these,
everything.
this prolactin and oxytocin when it is when the baby is
Yeah,
conceived, at that time, what happens the baby suckles and the
yeah.
milk is let down, the milk comes out. Now during this, if there is a disruption in this also, then there is no lactation.
No
So
lactation.
many females, they complain of no lactation after the birth. So this is also because of the disruption in the
Yeah. So
hormonal
definitely. Yeah.
Yeah, ma'am.
cycle. So it is
Dr.
totally
Rajeshwari,
a ecosystem. It's the female body itself, the hormones. It is an ecosystem in itself,
Has
and
to be maintained in balance.
it has to be maintained in balance.
Otherwise, you get PCOS, infertility, irregular period, many problems starts.
Yes. So in relation to the testosterone, as it is related to the female aggression, the muscle mass, the libido,
Bone density. Yeah.
bone density, and all these things, Now, what Anna has to say about it?
Well, about the testosterone, not much. Yeah, it's important to keep it in check, but we also notice that more and more women nowadays also have increased level of testosterone, and this is simply because women are put in a different lifestyle, too much pressure.
What do you
And
advise if a female comes with a low libido or frigidness?
well, it's definitely, I always, like for any problem that women have nowadays, I feel like women need more rest, and we are not talking enough about the value of rest. And rest is not something that needs to be earned, or that you have to work so hard in order to rest. Rest is something that actually builds all these hormones. Like if you don't rest, you won't have enough progesterone. If you don't rest, you won't ovulate, because progesterone is created only if we ovulate. And if we don't ovulate, and many women cannot conceive because they don't ovulate, and then they don't feel because during the ovulatory phase, which is like an inner summer, then we don't feel the high libido, because normally that's when the female sexuality peaks, during the ovulation, and then you won't be able to experience this. So everything is like, everything that has its highs needs to have its lows. You need to rest enough in order to actually reach that peak and feel that you have the sexual desire. And I
Yes,
feel like so simple, rest is the most
yes.
underrated,
I agree with
simplest
you,
medicine
Anna.
of
Rest
today.
is very important, and rest, the beauty sleep, which you say for females, is very important. It's just not related with beauty, but all around
Not with
wellness,
beauty, and
well-being of
it's really
the female.
important to sleep earlier. According to even Ayurveda or the Chinese medicine, it's important to sleep latest around 10 p.m. in the evening, or 10:30, different versions, because that sleep before midnight is the
Yes.
most restorative
And
sleep.
also in a hectic day, a 5 minute or 10 minute nap or is also very important, Coming
Yeah.
to
Yeah.
yes, this Dr. Kalyan.
Actually, I just wanted to add a point to continue this discussion.
Yes.
As Dr. Babita and Anna rightly said, the stress you need to manage it, and the sleep is very important. Because what happens, there is a PNE axis in our body, psycho neuro endocrine. Now psych is what your thoughts and feelings, neuro
Hmm.
is your brain, and endocrine is your hormonal system. So this all these things are connected. So whatever thoughts and feelings are there in your mind, accordingly your brain gives command to your hormonal system. And that's why when you are stressed, you are overthinking, there are some relationship issues, or there is work pressure, or there is burnout, or there are suppressed feelings, everything, or physical exertion also, because your body can't differentiate emotional stress and physical stress. So all this leads to increase in stress hormone, that is cortisol. And under action of cortisol, again your testosterone level gets
Correct.
increased. And
Continuing with this point, which Dr. Kalyani said, rightly said, this release of cortisol,
yeah,
depending on the stress and the overthinking thoughts, negative thoughts, all these things. How to control that? So I would say that the meditation is a very important aspect which helps in releasing your stress and helps in calming your mind, also indirectly helps in regulating your hormones. So, as you say that all the stress which happens, which makes to happen the dysregulation of these hormones, the lady is not able to conceive, she goes into stress, and then this cycle repeats and repeats and repeats, and then she goes for all those hormonal treatments, chemical treatments, and all that drugs, and that again spoils the female's body. So one important thing is to keep the hormones regulating. One should start practicing meditation right from the puberty age itself. Because meditation and then exercise. Exercise also helps in releasing, the happy hormones, and then that also regulates and keeps the all the hormonal cycle in symphony. Okay, and continuing with Dr. Charitra. Yes,
Yeah,
what do you have to
thank
say?
you, ma'am. Actually, I just want to add few points to your point only. Meditation itself is very, calming,
Yes, over.
calming term.
Okay.
Apart from, am I audible?
Yes, you're audible.
Yeah. Apart from meditation, like breathing exercises, as well as, just get into, indulge into the activities or hobbies, because that also releases happy hormone. Like if you are inclined towards singing, dancing, or playing badminton, or playing with the kids, that these activities also releases happy hormones, because you enjoy doing these kind of activities, and it relieves your stress, venting out of your stress, or meeting friends. I've now it's
Yeah.
a kitty era, so many women get together, and they have fun, they sing, they dance. So that is not wrong.
That's
I
not
think
wrong,
that is very
actually.
important part of
And
your life.
it has been in our Indian culture, we have this. I think in ethnic other cultures also, there is this bonding of females, which helps in, the regulating of the hormones, because all the Shaktis coming together, it is the exchange of energies, and the similar way the hormones also, get affected, and there is a feeling of happiness, which helps in, the well-being of a woman. So it's very important. You need to have a close group of female friends, and meet them few days after, and you can enjoy, you can have fun moments. Okay, not necessarily professional moments. So it's very important. I do that regularly, and everybody should do it, I feel. Yes, continuing with the maintaining the harmony along with the remedial measures, which already we discussed some of the points. Let us discuss some few more points. We discussed about the sleep, we discussed about the rest, we discussed about the bonding between the females, and let us discuss something about nutrition and diet in relation to the female hormones, female well-being. Yes, who is going to tell about this?
See,
Yeah.
there are few things like you need to have nutritious diet. There should be high protein content in your diet, and you should reduce the processed food and preserved food. junk food basically. You need to reduce that and hydrate yourself very well. That also keeps a very good note of your hormones. So that is very important. It's very easy actually.
Yes, it's easy. Rather than having the bottled foods or packeted foods,
Yeah.
if one because in this world the ladies especially have a more active taste buds, so we sometimes feel like having something like spicy or something like zinc, adding zinc to our tongue. So you can prepare it yourself at your home, some nutritious foods, and we are best at it, women, in cooking, and so we can have it, we can make it for ourselves, we can make it for a family. So make some good nutritious foods, snacks for ourselves, and that will be good actually, rather than preferring the fast foods which are packeted and all available at the stores and all. So I just avoid that. So that is one of the very important factors, maintaining your diet. Adding more fiber to your diet is also one thing, rather than having only one kind of having a balanced diet. Yes, Dr. Sucharitra, you can continue.
Yeah, ma'am, I would like to add one more point. Like as both of you mentioned, Dr. Kalyani and you, ma'am, nutritious food actually keeps your cells healthy, right? And along with that, I just want to elaborate like few of the fruits like cherries and strawberries, banana. These enhances your mood and keeps like it has got fruits has got antioxidants, but especially these fruits, they increases your happy and have hormones. So if anybody
Yes,
else
yes.
would like to
Yes,
add to it.
And soya bean is one of the soya bean chunks or soya bean
Yeah.
beans. If you add it to your diet, it's a source of estrogen, and it helps in regulating your estrogen. So you know that it's a female hormone, and it regulates everything, your body, your skin, and your feelings of happiness and all that. So add soya bean, females especially, okay? And just check in with your, if you have any hormonal problems, like if you have thyroid and all, then you have to also check not to have it. And another thing about the diet, when you see, there's a lot of research going on, and it is proved that the gut microbiome, okay, the gut microbiome has to be, balanced, and you need to have food which is very important and which will regulate your microbiome. So food, especially curds, buttermilk, which we usually have in India. It is a constituent of our Indian diet. So having curds and buttermilk is very important, especially homemade, rather than having it from the stores, packeted. Nowadays, people are using the packeted ones. So avoid that, and have lots of curds, and keep your gut clean. Have lots of fiber, fruits that will keep your gut good, and some of the hormones which are produced through your gut also helps in the regulation of the female hormonal cycle. So that's very important. Okay, so continuing with the treatments, especially we are all homeopaths here. So let us discuss some homeopathic medicines which are helpful in regulating the female menstrual cycle, okay, in menopause, in perimenopause. So Dr. Kalyani will say, because she has lots of PCOS, PCOD patients. First, she will explain about the difference between PCOS and PCOD.
Yes. Thank you, madam. PCOD is polycystic ovarian disease, and it is related only with ovaries. Okay, and you get cyst, your USG flows polycystic appearance. That cysts are there on your ovaries. But PCOS, it's the later stage. It spreads in simple words, it's higher stage, because there are many times the USG is normal in PCOS, but your insulin resistance is there, and that's why you get unwanted hair growth, infertility, irregular or absent periods. So many women, they don't know what is PCOD and PCOS. So when your PCOD is not treated properly, you progress to PCOS. That's what I have seen in my practice. So natural medicine and what the all those points, like along with medicine, diet, exercise, and stress management, for that breathing exercises and yoga and meditation, everything we have discussed. All this combined approach works very well for all these thyroid, PCOS, PCOD. That's what I have seen in my practice.
Yes, correct. So there are lots of medicines in homeopathy. There is a treatment. Apart from that, lifestyle management is very important. Most of the patients, they expect that the medicines will treat us. But apart from the medicine, there is a lot of effort to be taken from the patient itself. The homeopath counsels them, helps them to motivate and, help them to maintain a good lifestyle. So whatever the necessary lifestyle is required for the disease, that is, motivated by the doctor, and the patient ultimately follows it and then feels well. Yes, yes, Anna, you can continue.
Thank you. Yeah, I feel like we have touched all these points, and we talked about, how to feel better and meditation and calming ourselves. But then there is this point where every woman comes to her life where she feels angry, where she feels frustrated, where she feels rage, for whatever reason, whether it's, home related, work related, relationship related. Like, I think it's very important to talk about that, what to do when you feel this surge of challenging emotions that, that are not bad or negative. They're just information of what is going on with your body. And just going into meditation or going straight into dance, it's not going to be easy to just quickly transition into something like that, happy or calm. So it's important to express these emotions. First of all, it's important to name them, to give them the name, so they are not kind of haunting you and holding you. This is very, very important.
Very important.
If you have your circle of female friends or friend or anybody to talk to, expressing that verbally is very important. The second thing is expressing that through movement or sound with your body. And I cannot emphasize enough how important that is, so all these stagnant emotions then, or suffocating emotions, don't spiral into a disease later on. So
yes,
just like
absolutely.
Some kind of safe way of, I teach my clients cathartic release practices, like stomping your feet or with your fists, like, like pointing with your hands down, or like trying to shake something off you, or kind of screaming where, nobody would think that you are in danger, or whatever, like really releasing.
Continuing with
Yeah.
your point, as you said,
Yeah.
that aura exercises, which you say, shaking your hands, okay, feeling your aura, releasing the aura. All these exercises are also there, which a female has to do along with your female friends as a fun exercise or a ritual. There are certain female circle rituals which are formed, which are done in this way. So
Yeah.
if you practice that, it also helps. Along with that, I would like to say that it is a cycle. When a female expresses or suppresses her emotions, most of the females tend to suppress their emotions. Very less females, they express it, either in her friend circle or in her family. Sometimes she's not let to express herself, So this usually happens and tends to happen during the sudden change of life, in puberty, during menopause, during your childbirth. That's when the female goes into depression.
Yes,
Okay,
during
and this
postpartum.
is the stages when the family, that is the immediate people who are next to her, her siblings or her parents. Okay, if she's married, then her husband, or if she is at an older age, then her children. They have to understand what the lady in the family is undergoing, and they have to support in her crisis, in this age crisis, you can say, the sudden change of hormones, sudden change of life. So in this stage, if the woman is taken care of, then she will be like,
Yeah, that is true, but
become
nobody will just
ravishing
come.
and,
Nobody will come and say, "Hey, like they will offer care." I think
yes.
woman is the one who needs to lead with that, because they cannot feel how she feels, so she needs to know that she needs to do something to first help herself, or ask for help, or ask for that support. I think that's a very important point.
Yeah, I
Okay.
also like to add here one point. Like in continuation with the discussion going on, I always tell my patient, like, first love yourself, because they love their family, their friends. They take care of everybody. They take care of their diet if they are not feeling well. But when it comes to herself, she just neglects. Okay, I will go on. I will look it after later. She keeps herself behind. So she should love herself. That will help.
Yes. So these are some of the, lifestyle changes and how a woman can take care of herself and how her family and friend circle can help her in this change of life and in her, disruption of the orchestra of her hormones. But one more thing about the medical treatments that is there to be discussed about the homeopathic medications which we give, and depending on what kind of changes which we see in a female. Okay, so if there is a emotional dysregulation and the female is not able to express her feelings and she just keeps on weeping and sobbing, and sometimes when she comes to the doctor, then she expresses that in front of the doctor. Yes, and the homeopathic doctor specially inquires about all these things, that how is her mental condition, how is her menses, right from her childhood. He or she, the doctor asks her about all these things. And that's when we come to the root cause of her, disease. And then we prescribe the medication depending on her complete well-being, like her mental changes, her physical changes, her spiritual changes, all these things we understand and give the medications. So there are certain cases like Dr. Kalyani said, PCOS or PCOD. There is the dysmenorrhea, the pain, severe pains during the menstrual cycle, premenstrual syndrome, okay, where the breasts get tender, and then all these things. Within a few doses of homeopathic medicines, the patient gets well. Okay, there was recently there was a case where a lady, a female, around the age of 23 years, she came and she had a surgery, and she was having vaginismus, and she was not able to explain what's happening with her, but she was feeling uneasy, and she was not able to express until I dug into her family history, I dug into her personal history and everything, and then I came to know that she's having this problem. So after the surgery, she came and she was having this kind of condition. And then when the medication was given, within 2 days, she said that I'm feeling absolutely well. So these are the things which females are unable to explain to the doctor also. And it's the role of the doctor here in the homeopathic doctors inquire about all these things and then give the medication. And one thing for more sure, I will tell you that one medication is not given to the another person with the same condition. So as two individuals are different, in the similar way, the medications also differ to different people in different conditions. So this is how. Continuing with this, Dr. Sucharitra, you have to say something.
Yes, ma'am. As you said, premenstrual symptoms can be, very well controlled with the help of homeopathy. So, we can also, give the medicine for calming down the, calming the anger or irritability, or any kind of suppression the female is going through. We do have medication for that also. Like Staphylococcus aureus is there, and belladonna for premenstrual dysmenorrhea, or Apis mellifica is there. If there is, PCOD, or along with, corresponding symptoms, they act so wonderfully. And magnesia phos, because deficiency of magnesia also leads to, dysmenorrhea. So there are a few set of medicines which I mentioned because I've seen very wonderful result, immediate result, as you mentioned, Dr. Rajeshwari ma'am. So with the help of homeopathy, we can manage very well these premenstrual symptoms as well as PCOD or PCOD. I think Dr. Kalyani can explain.
Yes, I would like her to explain about that.
Yeah,
Medicines which are
PCOD
given
and
for
PCOS.
PCOS and PCOD.
PCOS is a very rising, I will call it
Condition.
like an epidemic. 8 out of 10 girls, they are having these symptoms
Yes.
because we have changed our food habits, we have changed our lifestyle, and everybody is under stress, like the school going girls also. So I
Yes.
have seen, I follow the constitutional medicine also helps to regulate these hormones very well. And along with that, whenever there is heavy bleeding and prolonged bleeding, very painful bleeding, Sabina, then Thalapsy bursa, Colosynthesis, Macphos, these remedy work very well. And also I use cinnamonium Q to stop the profuse bleeding. Because many times women come with, they are having bleeding since 15-20 days and it's profuse clotted bleeding. This medicine acts wonderfully to regulate the flow.
Yes.
And for constitutional medicine, Natrum mur, then Actia racemosa, Lycopodium, Sepia. These are very common among these
I
PCOS
also used
cases.
Euphoricum and
Yes,
folliculinum
yes, yes.
also.
Euphorinium, then Lecitinum.
Yeah.
These are very
So,
nice remedies to for ovarian health.
yeah.
Even APIS, madam, APIS works very well
Epis.
for the polycystic
Especially for
ovary.
those women who tend to have abortions in the third or fourth month.
Yeah,
APIS works very well, and the lady in the next, after taking few doses, in the next few months, she comes with she comes pregnant, and she says,
yeah.
now it has settled, no problem. So I have seen many
Pulsatilum,
cases in this.
Calcira Natrum carb, it's very nice.
Yes. So now let's move on to the menopause, perimenopause and menopausal stages, where the female starts having some complaints. Sometimes they're normal also, which can be managed by lifestyle, and sometimes it may become because that's the age when a lady can go into some cancers like breast cancer or cervical cancer. So that's very important that during this age, a female should go through all the screening. And when if she faces some problems, or even if she doesn't face as a routine, she needs to go through the screening to keep herself in check. So that's very important. So when lady goes into the premenopausal, perimenopausal, you see that she starts getting this irregular periods. There may be tenderness in the lower abdomen, lower back, and all kinds of wandering pains, and maybe sometimes sleeplessness, irritability, and all these. These can be managed by homeopathic medicines as well if it is very severe and she is not able to do her regular duties. Either at home or at work, so this can be managed by homeopathic medicines as. And coming to the menopause, where there is complete cessation of the menses, and then starts the deterioration of the female tissues, where there is osteoporosis starts, and bone health deteriorates. Then also at that time also she needs to take care of herself by doing some mild exercises, okay, controlling her diet during, because at that time usually starts from the perimenopausal stage, there are a lot of cravings, and that's the age when one starts getting obese, and one has to keep a check on that as well. So doing a regular exercise, and maintaining a good sleep, having good food, and all this helps in reducing your weight, maintaining your weight, and there are many risk factors of your obesity also. So that lady has to understand, and she has to take care of herself. Okay, for menopause also, if there are some symptoms, like sometimes patients come to me after 1 or 2 years of cessation of the periods, again the periods start. So that's again a red signal. So you need to go through all the screenings and understand why these periods have occurred again. And then proper medication and treatments have to be given. Okay, so that's about perimenopause and menopause. Yes. What,
Age, I
Dr.
just want to
Sucharitra,
mention, yeah.
about the hot flashes? Many of the ladies come to us with hot flashes.
Yeah.
So there are very good medicines in homeopathy, hot flashes,
Right.
headache. Okay.
Yeah.
So there are different kinds of headaches. Some ladies come with, backside headache, occipital headache. Some come with a frontal headache. So
Frontal.
depending on the types of headaches, we give the medicines also.
Yeah,
for the hot flashes also there are medicines. Yes, Dr. Sucharita, you can continue. There are only
Yeah.
5 minutes left.
Okay. I just want to mention about the age, like 45 to 55 years are supposed to be menopausal age. But if menopause occurs before that,
Yes.
before 45 years, it is called early menopause. And if the lady attends menopause by 40 years or less, that is premature menopause. It
Yes.
should be
And
explained to the
I would like to
patient.
add one thing here. Nowadays, there is menarche also. When the first menses starts, that also starts earlier nowadays. And menopause is also happening very early. So 35 and 40 years of age, we are seeing patients who have already stopped having menses. So this has becoming, I think, abnormally normal. So one has to keep that in mind and get yourself checked for it. So why the menses have stopped so early? You need to go to a doctor, get yourself screened, and if necessary, treatments have to be followed up.
Yeah, I just
So
want to
that
mention the FSH and LH, which
Mhm.
increases during menopause. The person can get these hormones tested, and we
Yeah.
have wonderful medicines for like menopausal symptoms also, like amyl nitrogen and pulsatilla, sepia, lycopodium. I think you can also add if anybody of you would like to add the medicines, because I have seen
Yes.
many many
Yes.
cases with these few medications.
Yes, that was a very wonderful discussion. Dr. Prachi, are you there? Are you there?
Yes, I'm very much here.
Yeah. So, what do you feel? A few words from your side?
I think I realized a lot of things I'm undergoing through. Thank you so much for this session, Dr. Rajeshwari. And I would request our other G100 Wellness Wisdom women to definitely watch this session because it is so informative, so useful. Thanks to all the doctors there. I think, दिमाग के ढक्कन खुल गए types. All my blockages got opened up today because, see, even I'm pretty sure I'm 49 and I'm undergoing premenopause and all that. So as of now, I'm taking it very positive and all, but I got a lot of tips today how to take it forward. So,
Yes,
and
we hope that all the ladies who are watching this get a lot of help and take care of yourselves, all ladies, because you are the backbone of your family, and it's very important that you mother yourself
Dr.
because
Rajeshwari, it is not about that we are the backbone of the family. I think because, like we are the engine who runs everything, whether it's a workplace or a home place. And if
yes.
the engine stops, everything around stops.
Correct. Engine
So,
engine is also right, and of course, even the engine stops, everything stops, and it's a hell of thing with bricks, and I know I can understand that. So,
yeah.
talking about the female ecosystem, you
Mhm.
know, the female itself is, in one sense, the earth. Recently our Earth Day, World Earth Day
Yeah.
happened. So I would refer that the women itself is a earth in herself, and how the earth, Mother Earth, take cares of herself. She shuffles and reshuffles, and all the waste is discarded, and she takes so care of herself in a wonderful way. How you try to destroy Mother Earth doesn't matter. She knows how to take care of herself.
Yeah.
So let all the women, you know, understand this and take care of themselves. And always be, if you take care of yourself, you'll be able to take care of your family and of the country and of the world. So this
Yeah.
is to
True.
summarize in short. And let us take leave from this webinar and hope uh, everybody is happy and satisfied with this webinar. And if you have any
On
questions,
behalf of G100 Oneness, I'm so grateful to each and every one of you for, like giving so much of wisdom on this topic. See, bits and pieces we have been talking about menopause, but I think we never had such good pool of doctors together. So I think it made a huge difference today. Really made a huge difference. Really indebted to all of you. Thank you so much.
And thank you very much for giving us a platform here. And if any question bothers you, or if you need to have any other topic related to medical system, you're welcome, and you can just put up
Definitely.
here. And any questions from the audience, do put in the YouTube link below, and we would answer you. Okay, thank you so much. Here we close the
Thank you,
session.
and good night, everyone. Thank you
Good
so much,
night,
everyone.
Thank you.
everyone.
Thank you. Good night.
Thank you. Bye bye.